All right, so you're gearing up for that LPN exam, huh? Well, we all know nutrition's a big part of it,
It really is.
and it can feel pretty overwhelming. So think of this as your personal study, shortcut your deep dive into the core nutrition knowledge you need to ace that test, and more importantly, to take amazing care of your future patients. We're going straight to the source, a chapter dedicated to nutrition and nursing.
Yep. We'll be pulling out the must-know principles, dietary guidelines, all the stuff that'll make you feel confident and prepared.
So we're not just skimming the surface here. This is about understanding the why behind the what, like why certain diets are important for certain conditions, why specific nutrients matter. You know the stuff that'll actually help you in your nursing career.
Absolutely. It's about connecting the dots between the science of nutrition and the reality of patient care. Because as an LPN, you're going to be on the front lines using this knowledge every day.
Okay, so let's start with something everyone needs, energy. And that brings us to carbohydrates, often shortened to CHO. They're the body's primary fuel source. But there's a lot more to it than just that, right?
Right. You know that saying, food is fuel? Well, for the body, carbs are like premium high-octane fuel.
Premium fuel for the brain especially, I'd imagine.
You got it. The DRI, the dietary reference intake, says you need a minimum of 130 grams of carbs per day just for your brain to function properly. That's for both adults and children. It's the bare minimum. And when we talk about the AMDR, the acceptable macronutrient distribution range, we're looking at carbs making up 45 to 65% of your total daily calories.
Wow, that's a lot. So why is it so crucial for nurses to really grasp carbohydrate intake for their patients? I mean, beyond just keeping their energy levels up.
Well, there's this concept called the protein sparing effect. See if your body's getting enough carbohydrates, it doesn't have to tap into protein for energy. And that's huge because protein has so many other important jobs, like repairing tissues.
Oh, that makes sense. So especially for patients recovering from surgery or injuries, enough carbs will help their body use protein for healing, not just for fuel.
Exactly. And let's not forget the brain and nervous system rely heavily on glucose for fuel. And glucose comes from, you guessed it, carbohydrates.
Okay, so CHO is essential, but it's not as simple as just saying eat carbs, right? There are different kinds. It's not all just bread and pasta.
You got it. We can break down carbohydrates based on how their sugars are structured. The simplest are monosaccharides, which are single sugar units. Think glucose like what's in corn syrup, fructose, which is what makes fruit sweet, and galactose, which is part of milk sugar.
Okay, so those are the single sugars. Then what?
Then you've got disaccharides, which are two sugar units linked together. That's your table sugar sucrose, your milk sugar, lactose, and things like maltose, which is what you find in malted drinks.
Okay, so those are two sugar units. So there are even more?
Absolutely. We call those polysaccharides, and they're basically long chains of sugar units. These include starches, which are abundant in grains, legumes, and root vegetables like potatoes. And then there's fiber. That's the indigestible part of plant foods that you find in whole grains, fruits, and veggies. And lastly, there's glycogen, which is how our body stores glucose for later use.
Ah, that makes sense. So when someone eats these carbs, what happens in their body?
Well, the liver's like the central processing unit for those simpler sugars. So fructose and galactose, they get shipped off to the liver and turned into glucose. And that glucose then enters the bloodstream. Now, when blood glucose levels rise, the pancreas releases insulin, and insulin acts like a key unlocking cell so that glucose can get in and be used for energy or stored for later.
Fascinating. So what about the starch we eat? How does our body break that down?
Our digestive system is surprisingly efficient at that. So in the small intestine, we have this enzyme called pancreatic amylase, and it gets to work breaking those long starch chains down into smaller pieces, first into disaccharides, and then eventually into those single sugar units, monosaccharides, that can be absorbed into the bloodstream. And get this, about 95% of the starch we eat is digested within just 1 to 4 hours.
That's pretty fast. Now, you mentioned glycogen before and said it's like our backup energy supply, right?
Exactly. It's stored glucose mainly in the liver and muscles. Think of it like your emergency stash of fuel. So between meals, when your blood sugar starts to dip, the liver can convert that stored glycogen back into glucose and release it to keep your levels stable.
It's like having a reserve tank.
Yeah.
So as a nurse, that's important to keep in mind, especially for patients who might have irregular eating schedules or conditions that affect blood sugar.
Right on. Oh, and one more thing about those digestible carbs, they provide about 4 calories of energy per gram. Keep that in mind.
Good to know. Okay, so we've talked about the carbs that our body can digest. But what about fiber? That's the indigestible carb, right? We always hear how important it is.
It's true. Fiber gets classified as a carb, but it's the part that our body's enzymes can't break down. So things like the pectin in fruit gums, cellulose, those tough parts of plant cell walls, and oligosaccharides, they pretty much pass through our system mostly intact.
So if we can't digest it, why is it so important, especially for our patients?
Well, think about it from a nursing perspective. Fiber adds bulk to stool, and that makes things move more smoothly through the digestive tract. It stimulates what we call peristalsis, those wave-like muscle contractions that push everything along.
So basically, it helps prevent constipation, which is a common problem for a lot of patients, especially those on certain medications or who are less mobile.
Exactly. And the benefits don't stop there. Fiber can help lower cholesterol levels, potentially reduce the risk of some types of intestinal cancer, and even regulate blood sugar by slowing down sugar absorption.
Wow, those are some serious benefits. So what's the recommended amount of fiber we should be aiming for in our patients' diets?
The AI for total fiber is 25 grams per day for women and 38 grams for men. And here's an interesting tidbit. Even though fiber can't be digested in the small intestine when it gets to the colon, it can be fermented by bacteria. This process actually produces some beneficial byproducts and a little bit of energy too, around 1.5 to 2.5 calories per gram, depending on the type of fiber.
Oh, that's interesting. So even though we don't directly digest it, we still get something out of it.
Exactly. It's all about that gut bacteria doing its thing.
Okay, so that's a good overview of carbs and fiber. Now let's move on to another essential building block. Proteins.
Proteins. They're absolutely fundamental. And, when it comes to how much protein someone needs, there are three main things that come into play, especially from a nursing perspective.
Okay, so hit me with those three factors.
First up, you've got tissue growth and repair. So think growing children, wound healing patients, recovering from surgery. They're all going to need more protein.
Makes sense. What's number two?
Number two is the quality of the protein in their diet. We're talking about how many of those essential amino acids a protein source contains.
And number three?
Number three is any kind of physiological stress, like illness or injury. Those situations can really bump up a person's protein needs.
Got it. So let's say a patient's recovering from a major surgery. They probably need way more protein than just your average healthy person.
You got it. And the RDA, the recommended dietary allowance for protein in a healthy adult, is 0.8 grams of protein for every kilogram of body weight. But that can definitely change based on those other factors we talked about. And the AMDR for protein is between 10 and 35% of your total daily calories. It's super important to make sure people are getting enough, because if they don't, it can lead to protein energy malnutrition.
Protein energy malnutrition. That sounds pretty serious.
It is. We shorten it to PEM, and it basically means the body's not getting enough protein and energy. In severe cases, it can lead to conditions like kwashiorkor and marasmus, which you might see in populations facing food insecurity.
So as a nurse, you'd be looking for signs of malnutrition like muscle wasting or problems with wound healing, because those can be tied to not getting enough protein.
Exactly. You want to catch those signs early. And just like carbs, protein provides 4 calories of energy per gram.
All right, so we know protein is important, but when we talk about protein sources, we often hear terms like complete and incomplete proteins. What's the difference, and why does it matter for a nursing student?
The difference is all about the amino acids. You see, proteins are made up of these building blocks called amino acids, and there are 9 essential amino acids that our bodies can't make on their own, so we have to get them from our food.
Essential meaning we absolutely need them.
Exactly. Complete proteins, they're the overachievers of the protein world. They contain all 9 of those essential amino acids, and they mostly come from animal sources like meat, poultry, fish, eggs, dairy. Soy is a plant-based complete protein, though.
Okay, so complete proteins have it all. What about incomplete proteins?
Incomplete proteins are usually from plant sources like beans, lentils, nuts, seeds, grains. And they might be low in or even missing 1 or more of those essential amino acids. But that doesn't mean they're not valuable.
Right. So does that mean someone who mostly eats plant-based protein can't get all the essential amino acids?
Not at all. That's where the idea of complementary proteins comes in. It's basically like teamwork. You combine 2 or more incomplete protein sources, and together they provide all 9 essential amino acids. And here's the thing, they don't have to be eaten at the same time. As long as you're eating a variety of these foods throughout the day, you'll get all the amino acids you need.
That's a good tip for when you're educating patients about diet. So classic examples are things like rice and beans or hummus and pita bread.
Exactly. Those are perfect examples.
Okay, so we know protein is important for building and repairing tissues. But what other roles does it play in the body? Stuff that nurses should be aware of.
Oh, proteins are like the multitaskers of the body. They're involved in pretty much every process. They help maintain fluid balance. They act as enzymes, speeding up reactions. They transport nutrients and oxygen. They form antibodies to fight off infections. They contribute to hormone production and even help with blood clotting.
Wow. I never realized how much they do. So it's not just about building muscles.
Not even close. They're essential for pretty much everything.
Okay, on to the next macronutrient. Lipids, which is just a fancy word for fats.
Fats, yeah, they sometimes get a bad rap. But just like carbs and protein, they're an essential nutrient that our bodies need to thrive.
So they're not the enemy.
Not at all. Fats are a super concentrated source of energy, and they play a ton of vital roles in the body. They come from both animal sources, like fatty meats and dairy, and plant sources like oils, nuts, avocados, the good stuff.
So break down those vital roles for me. Why do we need fat?
Well, first off, fat is stored energy. Think of it like your long-term savings account. It provides more than twice the calories per gram compared to carbs or protein. It's also key for hormone production.
Interesting. So hormones need fat to function properly.
You got it. Fats also form the structural components of cell membranes, meaning they help to define what gets in and out of our cells. They provide insulation, keeping us warm, and they cushion and protect our organs. Plus, they help our bodies absorb those fat-soluble vitamins like vitamins A, D, E, and K.
That makes sense. I guess if those vitamins are fat-soluble, they need fat to be absorbed.
Exactly. And one more thing, fats form the myelin sheath that insulates our nerve fibers, allowing for efficient nerve impulse transmission. So basically helping our nerves to communicate quickly.
Wow, fats do a lot. Okay, so not all fats are created equal, right? What are the main types that a nurse should know about?
You got it. The main categories are triglycerides, phospholipids, and sterols.
Triglycerides, that sounds familiar.
They should. Triglycerides make up about 95% of the fats we eat and store in our bodies. They're the most common type of fat. Phospholipids are an important part of cell membranes. And sterols include cholesterol.
Okay, and when we talk about triglycerides, there's all this talk about saturated versus unsaturated fats. What's the difference there from a health perspective?
So triglycerides are made up of 3 fatty acids attached to a glycerol molecule. Think of it like a 3-pronged fork. Those fatty acids can be saturated, meaning they have no double bonds in their carbon chain. Saturated fats are usually solid at room temperature, and they're found mostly in animal fats like butter and fatty meats.
Okay, so saturated fats are solid at room temperature. What about unsaturated fats?
Unsaturated fats, they have 1 or more double bonds in their carbon chain, which makes them liquid at room temperature. They're mostly found in plant-based oils. Unsaturated fats are further divided into monounsaturated fats, which have 1 double bond, and polyunsaturated fats, which have multiple double bonds.
So monounsaturated fats have 1 double bond. Polyunsaturated fats have many double bonds. Why does that matter?
Generally speaking, those unsaturated fats, especially the monounsaturated and polyunsaturated ones, are considered heart healthy when eaten in moderation, of course.
Makes sense. So what are some good examples of those unsaturated fats that we might want to recommend to our patients?
For monounsaturated fats, think olive oil, canola oil, avocados, almonds, peanuts. Good stuff.
Those are all yummy. What about polyunsaturated fats?
For those, think oils like corn oil, soybean oil, sunflower oil, and also those fatty fish like salmon and mackerel. They're packed with those omega-3 fatty acids.
Oh yeah, omega-3s. We hear about those all the time.
Yeah.
Are they a type of polyunsaturated fat?
They are. Both omega-3 and omega-6 fatty acids are considered essential fatty acids, meaning we can't produce them ourselves, so we have to get them through our diet.
Okay, essential meaning we absolutely need them.
You got it. And they're involved in some pretty important processes like blood clotting, blood pressure regulation, inflammatory responses. Lots of important stuff.
Okay, back to those other types of fats. Phospholipids and sterols, are those something we need to know for the LPN exam?
Phospholipids are important for sure. They're a major component of cell membranes, and they help transport those fat-soluble substances throughout the body. Lecithin's a good example of a phospholipid. You might see it as an ingredient in some foods. As for sterols, the most well-known is cholesterol, and that's where things get a little trickier.
Tricky in what way?
Well, our liver can actually produce all the cholesterol our body needs. But if we eat a lot of cholesterol-rich foods, it can contribute to high cholesterol levels in the blood, which is a risk factor for cardiovascular disease. So moderation is key.
All right, so when it comes to fats, what's a healthy range for intake? Are there any types of fat we should be telling our patients to limit?
For adults, the AMDR for total fat is between 20 and 35% of total daily calories. And as for what to limit, definitely saturated fat, keep it under 10% of total calories. That's because of its link to heart disease. And trans fats, those are the real bad guys. Try to avoid them as much as possible. They're often lurking in processed foods.
So read those labels carefully. Anything else to keep in mind?
Yep. Going too low on fat can also be a problem. If someone's eating less than 10% of their calories from fat, they might not be getting enough essential fatty acids or those fat-soluble vitamins. And for kids under 2, a higher fat intake is actually important for brain development.
Makes sense. So how does the body actually break down and use those fats that we eat?
Most of the magic happens in the small intestine. When fat enters the scene, the gallbladder releases bile, which acts like a detergent, breaking those big fat globules into smaller droplets. And then pancreatic lipase, an enzyme from the pancreas, jumps in and breaks those droplets down even further into molecules that can be absorbed.
So bile makes things smaller, and then pancreatic lipase breaks them down even further.
Yep. And once those fats are absorbed, they're packaged into lipoproteins so they can travel in the bloodstream. You've probably heard of lipoproteins before, especially when it comes to cholesterol tests. There's VLDL, LDL, and HDL.
Yes. VLDL, LDL, LDL, HDL. What are they all about?
So VLDL stands for very low density lipoprotein, and it's basically a transporter for triglycerides, carrying them from the liver to other parts of the body. Then there's LDL, low density lipoprotein, often called the bad cholesterol because it can deposit cholesterol in the arteries, which can lead to plaque buildup. And finally, there's HDL, high-density lipoprotein, the good cholesterol, because it helps to remove excess cholesterol from the tissues and bring it back to the liver to be processed and eliminated. Think of HDL as the cleanup crew.
Okay, so those are the main players in fat transport. And to recap, lipids are the most energy-dense macronutrient, providing a whopping 9 calories per gram.
That's right, they pack a punch.
All right, we've covered the energy-giving nutrients: carbs, proteins, and fats. Now let's talk about the micronutrients, those vitamins that don't provide calories but are still absolutely essential.
Vitamins, they're like the tiny but mighty nutrients. They're needed in much smaller amounts, but they play a huge role in keeping our bodies running smoothly. They act as coenzymes, helping enzymes to do their jobs, which is basically facilitating all the chemical reactions that happen in our bodies.
So they're like behind-the-scenes workers, keeping everything functioning.
Exactly. There are 13 essential vitamins, and we categorize them as either water-soluble, meaning they dissolve in water, or fat-soluble, meaning they dissolve in fat.
Okay, makes sense. So which ones are water-soluble?
The water-soluble vitamins include vitamin C and all those B-complex vitamins. The fat-soluble vitamins are A, D, E, and K. And just because they don't provide energy themselves doesn't mean they're not involved in energy production. They're crucial for the metabolic processes that release energy from those macros we talked about. Carbs, fats, and proteins.
Got it. So they're essential for those energy pathways to work properly.
Yeah.
Okay, let's start with the water-soluble vitamins. Vitamin C is a big one. What are the key things an LPN should know about it?
Vitamin C, it's also known as ascorbic acid. It's a powerful antioxidant, and it's all about tissue building. So things like wound healing and collagen formation, that's vitamin C's domain. It also helps us absorb iron and supports the immune system.
So it's a busy vitamin.
It is, and you can find it in tons of delicious foods. Citrus fruits, tomatoes, peppers, green leafy veggies, strawberries. Good stuff.
Definitely good stuff. What happens if someone doesn't get enough vitamin C?
A severe deficiency can lead to scurvy. It used to be a big problem for sailors who were at sea for months without fresh fruits and veggies. Scurvy causes bleeding gums, easy breathing, joint pain, impaired wound healing. Not fun.
Yikes. Sounds painful.
It is. And it's worth noting that people under stress who are sick or who smoke often need more vitamin C. Smokers are usually advised to increase their intake by 35 milligrams per day.
Okay, on to the B-complex vitamins. There are a lot of them, right?
There are 8 to be exact. And they're all about working together to keep those metabolic processes humming along, especially when it comes to energy production and nerve function.
So team players, where can we find them?
They're generally found in green leafy vegetables and unprocessed or enriched grains. So eating a variety of those foods is a good way to cover your bases.
Makes sense. Can we go through them one by one, just hitting the highlights for what an LPN really needs to know?
Absolutely. First up is thiamine, also known as B1. It's a key player in energy metabolism and nerve function. And if someone's deficient in thiamine, they can develop beriberi, which can cause a whole host of problems, neurological issues like confusion and difficulty with coordination, as well as cardiovascular issues. So it's pretty serious.
So thiamine is essential for both the brain and the heart.
You got it. And you can find it in lots of foods like pork, whole grains, and legumes.
Okay, on to riboflavin or B2.
Riboflavin is all about helping cells release energy. And when someone's deficient in riboflavin, it can lead to problems with the mouth and tongue, cracked lips, skin issues. You know those painful cracks at the corners of your mouth?
Oh, I've had those before.
Yes.
Not fun.
Yeah, definitely not fun. So riboflavin is important for keeping those tissues healthy. Good sources include milk, meat, and leafy green vegetables.
All right, next up is niacin or B3.
Niacin is a busy one. It's involved in energy metabolism, skin health, and even DNA repair. A severe deficiency can lead to pellagra, which has some pretty scary symptoms, dermatitis, diarrhea, and dementia.
Wow, that's a serious condition.
It is, but luckily niacin is found in lots of foods like meat, poultry, fish, and enriched grains.
Okay, on to pyridoxine, also known as vitamin B6.
Vitamin B6, it's essential for amino acid metabolism, the formation of red blood cells, and those all-important neurotransmitters, the chemical messengers in the brain. So basically, it's involved in a lot of things. And deficiency can lead to anemia and neurological issues. It's found in a wide variety of foods like meat, poultry, fish, bananas. But here's the thing, while it's important to get enough B6, taking very high doses from supplements can actually cause nerve damage.
So too much of a good thing can be a problem.
Exactly. Moderation is key.
Makes sense. What about pantothenic acid, another B vitamin?
Pantothenic acid, it's a team player involved in the metabolism of carbs, fats, and proteins. But deficiency is super rare because it's found in so many foods.
Okay, so we're probably good on that one. What about biotin?
Biotin, it's all about helping with the creation of fatty acids and other metabolic processes. Deficiency is uncommon, but it can cause hair loss and skin rashes. Not ideal. You can find biotin in foods like eggs, nuts, and seeds.
Okay, so biotin is good for healthy hair and skin. What's next?
Next up is folate, which is super important during pregnancy.
Ah, yes, folate. That's the one they always tell pregnant women to take.
Rightly so. Folate is crucial for cell division and the formation of DNA. And getting enough folate during pregnancy is super important for preventing neural tube defects in the developing baby. Those are serious birth defects that affect the brain and spine.
So folate is essential for healthy fetal development.
Absolutely. And if someone's deficient in folate, it can lead to a type of anemia called megaloblastic anemia. You can find folate in leafy green vegetables, legumes, and fortified grains.
Okay, good to know. And last but not least, in the B complex group, we have cobalamin or vitamin B12.
Vitamin B12, it's all about nerve function and the formation of red blood cells. But here's the thing, it's primarily found in animal products.
So vegans and vegetarians need to be careful about getting enough B12.
Exactly, they might need to supplement. And B12 deficiency can also happen if the body isn't absorbing it properly. This can lead to a condition called pernicious anemia, which can also cause neurological problems. So B12 is definitely one to keep an eye on.
All right, so that's a great rundown of those water-soluble vitamins. Now on to the fat-soluble vitamins A, D, E, and K. What are some general things to keep in mind about these?
The main thing to remember is that these vitamins are stored in the body's fat tissues. So unlike those water-soluble vitamins, which are flushed out in our urine, if we have too much fat-soluble vitamins, can build up and potentially become toxic, especially if someone's taking high doses of supplements.
So with those fat-soluble vitamins, it's important to be mindful of how much you're taking.
Exactly. And another thing to keep in mind is that their absorption depends on the body's ability to absorb dietary fat. So if someone has a condition that affects fat absorption like cystic fibrosis or Crohn's disease, they might be at risk for deficiency.
Okay, that makes sense. Let's go through them one by one, starting with vitamin A.
Vitamin A is all about vision, immune function, and cell growth. It comes in two main forms: retinol, which comes from animal sources, and beta-carotene, which comes from plant sources. Retinol is the preformed vitamin A ready to go, while beta-carotene needs to be converted by the body.
So retinol is from animals. Beta-carotene is from plants.
You got it. And if you're looking for good sources of vitamin A, think carrots, sweet potatoes, liver, and dairy products.
Got it. What happens if someone doesn't get enough vitamin A?
Deficiency can lead to night blindness and a higher risk of infections. And because it's stored in the body, high doses can be harmful, especially during pregnancy.
Okay, so pregnant women should be cautious about vitamin A intake.
Exactly. Their doctor or midwife will guide them on the appropriate amounts.
All right, what about vitamin D, often called the sunshine vitamin?
It's called that because our bodies can actually make vitamin D when our skin is exposed to sunlight. Pretty cool, huh?
That is pretty cool.
But we can also get it from food sources like fatty fish eggs and fortified milk and cereals. And It's super important because it helps our bodies absorb calcium and phosphorus, which are essential for strong bones.
So vitamin D is key for bone health.
Absolutely. And if someone's deficient in vitamin D, they can develop bone-softening conditions like rickets in children and osteomalacia in adults.
Okay, onto vitamin E.
Vitamin E, it's a powerful antioxidant, meaning it helps protect cells from damage. You can find it in foods like vegetable oils, nuts, and seeds. Deficiency is pretty rare, though.
Good to know. And last but not least, vitamin K.
Vitamin K, it's the clotting vitamin. It plays a crucial role in making sure our blood clots properly, and it's found in leafy green vegetables like spinach and kale. If someone's deficient in vitamin K, it can lead to excessive bleeding.
So that's one to keep in mind, especially for patients who are on blood thinners.
Absolutely. Vitamin K is also used to counteract the effects of certain blood-thinning medications.
Okay, so those are the fat-soluble vitamins. Now let's talk about minerals and electrolytes. I always get those two confused. What's the difference?
Minerals are inorganic elements that our bodies need for tons of different functions. They're kind of like the spark plugs that keep things running. And we categorize them based on how much we need. There are major minerals, which we need in larger amounts, think more than 100 milligrams per day. And then there are trace minerals, which we need in smaller amounts, less than 20 milligrams per day. Electrolytes, those are a special type of mineral. They carry an electrical charge when dissolved in fluids, and they're essential for maintaining fluid balance, nerve function, muscle contractions, all that good stuff. The big ones are sodium, potassium, and chloride.
Okay, so minerals are the broad category, and electrolytes are a specific type of mineral. Makes sense. Let's start with the major minerals. What about calcium? What's important for an LPN to know about it?
Calcium, it's the bone builder. Everyone knows that strong bones and teeth need calcium, but it's also involved in muscle contraction, nerve transmission, blood clotting. Lots of important jobs.
So it's not just about bones.
Not at all. And you can find calcium in dairy products, leafy green vegetables, and fortified foods.
Okay, so make sure your patients are getting their dairy and greens. What happens if they don't get enough calcium?
Deficiency can lead to muscle cramps, and over the long term, it can increase the risk of osteoporosis, which makes bones weak and brittle. But on the flip side, too much calcium can also be a problem, causing constipation and kidney stones.
So like most things in nutrition, it's about finding that balance.
Exactly. And as an LPN, you might be monitoring calcium levels in patients with certain conditions or those who are on certain meds. It's definitely one to keep an eye on.
Okay, what about phosphorus, another major mineral?
Phosphorus, it works hand in hand with calcium for bone health. It's also involved in energy production, and it's a component of cell membranes. You'll find it in lots of foods like dairy, meat, grains. Deficiency is pretty rare, but imbalances can affect calcium levels, so it's important to think about them together.
Okay, onto potassium. That one's super important for heart function, right?
Potassium, it's all about maintaining fluid balance inside cells, and it plays a key role in nerve and muscle function, including the heart muscle. You can find it in bananas, potatoes, tons of fruits and veggies.
So eating the rainbow is good for potassium.
You got it. And here's the thing, both low and high potassium levels can mess with heart rhythm, and those can be life-threatening situations. So monitoring potassium levels is a big part of an LPN's job in many different clinical settings.
All right, so potassium levels are something to watch closely. What about sodium? We always hear about limiting sodium intake. Why is it important, and why do we need to limit it?
Sodium, it's the main electrolyte in the fluid outside of cells, and it's essential for fluid balance, nerve impulse transmission, muscle contraction. Basically, it's all about keeping things moving and communicating. And we get most of our sodium from table salt and processed foods.
So those processed foods are the main culprits.
They are. And while we need some sodium, eating too much of it can contribute to high blood pressure in some people. So limiting sodium intake is a big part of managing hypertension.
Okay, onto chloride, another major mineral.
Chloride, it's often found hanging out with sodium, helping to maintain that fluid and electrolyte balance. It's also a component of stomach acid, which is important for digestion. And just like sodium, we get most of it from table salt.
Right, what about magnesium? I know that one's important for something.
Magnesium, it's involved in hundreds of biochemical reactions in the body. It's a busy mineral. It plays a role in muscle and nerve function, blood sugar control, blood pressure regulation. And you can find it in foods like nuts, seeds, leafy green vegetables. If someone's not getting enough magnesium, they might experience muscle cramps or even irregular heartbeats.
So magnesium is important for muscle function and heart health. What about sulfur, the last of the major minerals?
Sulfur, it's a component of some amino acids and vitamins, and it plays a role in protein structure. You'll find it in protein-rich foods, and deficiency is really rare as long as someone's getting enough protein.
Okay, so sulfur is tied to protein intake. Makes sense. Now, onto those trace minerals. We need them in smaller amounts, but they're still vital, right?
Absolutely. Think of them as the micronutrients with mighty roles. They're involved in everything from oxygen transport to hormone production to immune function.
So small but mighty. Let's start with iodine. What's its main role that an LPN student should remember?
Iodine, it's all about the thyroid gland. It's essential for the production of thyroid hormones, which regulate metabolism, basically how our bodies use energy. If someone's deficient in iodine, they can develop thyroid problems, including goiter, which is an enlargement of the thyroid gland. Iodized salt is a primary source of iodine in many countries.
So iodine is essential for thyroid function, and we can get it from iodized salt.
You got it.
Okay, what about iron? We talked about it earlier in relation to anemia. What are the key points to remember for the exam?
Iron, it's the oxygen carrier. It's
Right.
crucial for transporting oxygen throughout the body. And there are two types of iron in food. Heme iron, which comes from animal products and is easier for our bodies to absorb, and non-heme iron, which comes from plant-based foods and is a bit trickier to absorb.
So heme iron is from animals, non-heme iron is from plants.
Exactly. And some things can affect iron absorption. Vitamin C actually enhances non-heme iron absorption, which is why it's good to eat iron-rich plant foods with the source of vitamin C.